I'm ready.
Okay, perfect. Okay, perfect. Hi, first of all, can everybody hear me? I just want to make sure everybody can hear me good on the other end.
Yes, we can hear you.
Okay, great. Okay, so again, my name is Cynthia Leatherwood. I am specialist for ACLA, and for today's presentation, I am going to be talking about children and adolescent immunizations. So we can go to the next slide. On our agenda today, we have some important facts and information that I'm going to share regarding immunizations. I'm also going to talk some on our immunization schedules for both CIS and IMA. Then we're going to touch a little bit about what HEDIS is, the explanation, how we collect HEDIS data. We're going to go over our immunization measures for HEDIS, and then we're going to talk about some barriers and interventions. And then lastly, we're going to talk about NAVINET. I'm going to explain a little bit about NAVINET, how you can access that, some coding guidelines, and then some reports that you can actually pull from NAVINET. Okay, next slide. Okay, again, this is just a little slide I like to share of a little kid getting some immunizations. Again, we're going to talk about childhood and adolescent immunizations. Next slide. So some important key facts that I wanted to share in regards to immunizations. In July of 2020, the WHO and the UNICEF warned of an alarming decline in the number of children receiving life-saving vaccines due to COVID-19 lockdowns and the disruption of essential health services. Global vaccination continues to decline in 2021. There were 25 million children missing out on life-saving vaccines, 2 million more than in 2020 and 6 million more than 2019. And that's a pretty alarming rate when you talk about immunizations. Actually, for 2023, when I looked at the data, it is improving some with the new data out there, but still there are millions of children who are missing immunizations. Many factors contributed to the observed decline, including an increased number of children living in conflict and fragile settings, increased misinformation, and then COVID-19 related issues such as service and supply chain disruptions, resource diversion to response efforts, and containment measures that limited immunization services access and availability. So just a little bit of information in regards to how many of our children are missing vaccinations and some of the reasoning behind that. Okay, next slide. So when children are immunized, we know that when children receive those important vaccinations, that serious illnesses can be prevented. Family members are less likely to get a serious illness. The risk of community outbreaks is reduced. Immunizations are much more cost-effective than the treatment of the actual disease that can be that you can get if you don't get the immunizations. As far as complications, life is increased, life expectancy is increased, and then also travel and school enrollment is so much more easier when our children are immunized. Okay, next one. Here I just wanted to share some vaccine myths versus facts that are out there, some of the myths that are out there that parents may believe, and then some of the facts that are behind it. This is a document that I'm sharing, but this is also a document that we did here at AmeriHealth Caritas. We developed a vaccine myths versus facts flyer that we can share with our parents to just kind of show them, you know, when they have these myths, to show them the facts that are behind it, to maybe aid in helping them get some of the myths or vaccines aren't tested enough. And then we come back and we explain to them that vaccines are very safe and that before a vaccine's given, the testing process that it goes through and children are safely vaccinated each year. Another myth is sometimes parents may believe that the vaccine doesn't work. And then we try to explain to them that vaccines may help stop many diseases that are used to make people very sick, and that the vaccines can help build to a specific disease. Vaccines may contain harmful ingredients, and we go on to say that although they may contain ingredients, that this allows them to be safely given. Sometimes parents believe that there are a lot of side effects with these vaccines. And we come back and we say that most of these side effects are very minor, like soreness given, some achiness, some fussiness in babies, maybe a little bit of low-grade fever, and that the side effects usually only last a couple of days and can be treated. Another myth is that vaccines may cause autism. And we do show that studies continue to show that no relationship between vaccine and autism, there's no relationship out there. Some parents may believe that they don't need vaccines, that their natural immunity is better than a vaccination. And we try to explain to them that many treatable diseases are dangerous and cause lasting side effects, much safer and easier to get the vaccine. Some parents may believe that a child can get the actual disease from the vaccine. And we go on to say that a vaccine causing a disease would be very unlikely. Most vaccines are inactivated or killed viruses, which make it impossible for them to get the disease from the vaccine. And lastly, they think that maybe you can't get the COVID-19 or a flu vaccine with other vaccines. And we go on to tell them that there's no waiting period and that they can get these vaccinations at the same visit. So we just wanted to share some of the myths versus facts when we talk about vaccinations. Next slide. So on this slide, on the next couple of slides, I'm just going to share some of the recommended childhood immunizations. I'm sure that the providers on here know what they are, but these are just different ways that we present them or ways that you can find them out on our website. So here is the recommended childhood vaccinations or immunizations, and we have them in the months whenever they should be received. And the next slide. And this is one that the CDC puts out. So the CDC actually has on their website the 2023 recommended immunizations for children birth through 6 years old. And then the next slide, you'll see that they actually have it out there for children 7 to 18 years old. And the CDC does a really good job on their website. You can go out and get these immunization schedules as well as other parent-friendly information out on the CDC website. So if you're wanting to share some information with your patients, they do have printer-friendly information out there that you can go and print out information to share or refer the parent over to their website. And the next slide. This is just another view of recommended adolescent immunizations. Here we list what the immunizations are. Again, 7 to 8, 9 to 10, 11 to 12, on up to 16 through 18 years of age. And these are the vaccines that should be given for that adolescent age group. Again, this information is out on the CDC website. Okay, next slide. This is here what we have is a preteen and teen well visit checklist that we shared with our members. This just lets our parents know what exams should be done and how often for their teen, and then the vaccines that they should receive and how often, and then also their screenings that they should receive and how often they should receive those. So this is just another avenue that we share with our parents to let them know when the teen should get it and also their checklist. And the next slide. So here I wanted to share with the group that we have a EPSDT provider toolkit out on our website for providers. It's a really good toolkit. And in there not only about immunizations, but also about well child visits and what constitutes that. It's a toolkit that can be utilized. And if you go out to our ACLA provider website, this can be found on that on the website. Okay, next screen. So we've talked a little bit about immunizations. Now I'm going to move on and talk a little bit about HEDIS. I'm sure most of everybody knows about what HEDIS is, but for insurance companies, HEDIS is a performance measurement tool that is administered by the NCQA, National Committee for Quality Assurance. It is used by 90% of America's health plans, and managed care companies that are NCQA accredited perform HEDIS reviews the same time each year. So what I like to tell providers, just kind of a little bit of a comparison. I'm sure that most of you know about Joint Commission in the hospital. So what Joint Commission is to a hospital, HEDIS is that for us at an insurance company. So HEDIS is how we kind of measure how we're doing from an insurance company's perspective. Okay, next slide. And health plans use HEDIS performance results to evaluate the quality of care and services. We use it to evaluate provider performance, and we develop a performance improvement initiative, and we also perform outreach to providers and members, and we compare performance with other health plans. And we do that with the data and the information that we collect from our HEDIS survey annually. Okay, next slide. So ways that we collect our HEDIS information, data collection methods. We collect data in 4 ways. We do it administratively, our administrative method, and that is obtained from our claims database and supplemental data. We do what's called a hybrid method, and that is obtained from our claims database and medical record reviews. That's where we go out and we look in medical record reviews to collect information such as immunizations, postpartum information, prenatal information, well child visits, those types of things. Survey method, we obtain member surveys, which would be our CAP survey, and then electronic clinical data systems, ECDS. So those are the 4 ways that we actually collect data in support of our HEDIS project every year. Next slide. Now we're going to talk about a little bit about our immunization as it relates to HEDIS and kind of what we do with this information. So, the abbreviation for that is CA. This is a LDH withhold measure for us at our insurance plan, and then we also use it as part of our NCQA accreditation measure. So for us, the HEDIS measure description is members who have all of the required immunizations by their 2nd birthday. And then for our accreditation measure, and I've listed here the immunizations that make up Combo 10. Okay, next slide. The next slide, we use immunization in adolescents, which is IMA. Again, that is a withhold measure for our insurance company, and we also use that as part of our accreditation measure, Combo 10, for NCQA. And we look at members who had all of the required immunizations by their 13th birthday. And again, you can see we've listed those immunizations here. One thing I want to point out, as providers, you may hear us say that, the members have to have it by their 2nd birthday or by their 13th birthday. And when we talk about our accreditation measures, I just want to point out, unfortunately, if a member goes in and they get those immunizations maybe one day after their 2nd birthday or one day after their 13th birthday, we're not able to count that, as we call it, as a hit for us, because it is done after the required birthday, and NCQA doesn't let us count those immunizations. So we do a lot of education here at the plan, trying to encourage our parents to get their children in before their 2nd birthday for all of their immunizations, or before their 13th birthday, their immunization. So on this slide here, I just wanted to share some of our barriers and some of our successes and interventions when we talk about childhood immunizations for children and adolescents, some of the barriers that we encounter, and then some of our interventions and successes that we've for those barriers. So some of the barriers are parents lack knowledge of the importance of the adherence to the recommended vaccination schedules. And what I mean by that is sometimes parents may take their kids in after their 2nd birthday or after the 13th birthday, and they may not realize how important it is to get them in before their 2nd or 13th birthday. Members are not established with their primary care physician. Sometimes our members may not realize or know who their PCP is. Parents tend to only visit the doctors when their child is sick. That's another big one. Sometimes parents may not realize how important it is to not only get them in for the immunizations, but to get them in for the well child visits. Vaccine myths versus facts that we went over earlier. Sometimes parents actually believe those myths, which in return kind of stops them from getting the immunization. Claims for administrations, but no claims for the specific immunizations. Sometimes it's how the claim is billed. If it's not billed correctly, then we're not able to count it. Providers are unaware of the immunization care gaps for their members. And we're going to talk a little bit more about that in NAVINET. Sometimes providers may not realize that the actual member or the patient is behind on their immunizations. And then here's another big one, is member loaded into the links system, resulting in matching issues. And what I mean by that is links is the state's immunization registry, and it has to be an exact match between facets and links. Remember that, meaning that the information has to be an exact match whenever being loaded. So what are we doing to address some of these barriers? So some of our successes or interventions are, we have a reminder texting campaign where we send out texts to our parents to remind them about getting their children's immunizations. We offer an incentive if they go in and they get their well child visits and immunizations, they can have some monies loaded onto their care card. We do social media campaigns. We put out messages out on Facebook, different avenues like that, on the importance of receiving vaccinations and their well child visits. We do end of call scripting during the flu season, reminding parents how important it is to get their children's flu shot. We also do website and member newsletter articles on immunization and well child education. We have a member reassignment policy in regards to members not seeing their PCP. If they're not seeing their PCP, we're going to take knowledge of that and try to assign them to another PCP. We do summer letters with immunization education. We send out information to our children. This year, we actually did some summer letters, or a letter to the 3 to 17 age group for well child visits. We did it from a disparity standpoint and identified those where there was a disparity noted, and we sent out some information to them so they could get in and get their well child visit. We have a immunization education flyer that we've been working on for a well child guide that we've developed that has really good resourceful information in it that's going to help the parent understand about well child visits, immunization. We're going to put the immunization schedule in that, and we're currently working on getting that approved so we can share that with our members. We do community events. That's a big thing for our health plan. We're always out in the community providing education for our members or potential members. We do manual outreach. We have a rapid response outreach team, wellness team, and they work with us here in Quality on education and appointment scheduling. And that's the big thing. I'm working with them now as we speak on outreaching to some of our members where we've identified that there's a disparity, whether it be race or geographical, and we've identified those non-compliant members, and RROT is going to help us out by calling the parent and trying to provide some information and get them in to get that appointment done. We also do provider education regarding the utilization of the link system, and again, that appropriate documentation where we make sure everything's entered correctly so there'll be a match whenever we're pulling that data. So that is some of our successes and interventions and barriers that I have listed. We can move on to the next slide. So we've talked about immunizations, we've talked about HEDIS, talked a little bit about our barriers and some interventions. Now I want to talk about NAVINET, and probably everyone on the call is familiar with NAVINET. NAVINET is our free, easy-to-use, web-based application that provides real-time current and past eligibility status on our members, and it eliminates the need for phone calls to our plan here in Louisiana. And we provide fast, secure, HIPAA-compliant access to providers and member information, which enables real-time transactions. So here I've just shared a screen that lists the NAVINET link here, where you can use the self-service tool and log into NAVINET, and that way they physicians can log in, or the office manager and so forth can log in and follow up on the member to see what important visits or care gaps a member may be missing. Okay, next screen. So I also wanted to share with you some information here in case your password has expired or you forgot your username or just some other information. I've listed the Navinet telephone number here, and they can help you get logged in if that need occurs and you can't get in. Okay, next screen. So here I wanted to share within Navinet, we talked a little bit about HEDIS a while ago, and I explained a little bit about what it was and about some of our measures. Well, within HEDIS, you will find our HEDIS documentation and coding guidelines. You can see over here on the right, pointing to where that can actually be found under the resources link in Navinet. And I know it says HEDIS 2022, but I just want to let everyone know that the 2023 HEDIS documentation and coding guidelines are out there. They have been updated. Another thing that you can do is a PCP performance roll-up report. So in Navinet, as I said earlier, you can go in and you can pull a care gap to see what care gaps are missing for your member. They may be missing a well child visit, immunizations, and so forth. You can also use a performance report card or a PCP performance roll-up report to pull information and see how you're doing in your report card. And that information is here that explains a little bit about that, on how to pull that report. The other report on the next screen is your Care Gap Query Report. This is just another snapshot out of Navinet where you can go in and actually pull a Care Gap Query Report. And this provides information for members that are non-compliant for other EPSDT components such as developmental screenings, vision, hearing test, immunization, lab tests, and screenings. So this is just another avenue that you can pull a report out of in Navinet. Okay, next screen. So we're coming to the end here. Again, our goal is to help people get care, stay well, and build healthy communities. And we do that through a lot of different avenues, as I had said throughout the presentation, trying to outreach to our members and our parents that get their kids in, for well child visits and for their immunizations to stay healthy. I'm listed on the next screen here is my contact information. I've listed my email and my cell phone number, as well as Michelle Bruce Gibson, who is the program manager for EPSDT Population Health. In case anybody has any questions after the presentation, they can feel free to reach out to either one of us, and we'll be glad to follow up. And then the last screen is just images and our reference sources that I listed here. And that concludes my presentation for immunizations here for Project ECHO.